Hello everybody, I'm Tanya Cubison. I'm a consultant plastic surgeon at East Grinstead in Sussex. Today I'm going to talk to you about labiaplasty and a little bit about the operation, why we do it, and why you might want to have an operation under my care. So let's think about labiaplasty as an operation. It's all about rearranging the lips of the perineum, which is the area around your outer vagina. And this is an area that often gives people anxiety. Sometimes you're anxious because it is unsightly, or sometimes actually it is a functional problem and you can catch on things and it's difficult to reorganize your undercarriage when doing things, particularly like bicycling or riding a horse, for instance. But other people just find that it's unsightly and would like to do something different. So labiaplasty is an operation that can be undertaken just purely for the cosmetic appearance. It can be done because the labia, if large, can catch on things, particularly underwear with certain activities like riding a bicycle. But there are also other effects, such as recurrent urinary tract infection or things like thrush, that can be much more difficult to manage if you have extra tissue down there. And we do find that ladies will often find that their things like cystitis are much improved after having a labiaplasty operation. So labiaplasty can be done under local anaesthetic or under general anaesthetic. The operation simply is removing the extra tissue. So to start off with, we would numb the area, initially with some numbing cream and then with a local anaesthetic injection. Now that sounds awful, and the idea of having an injection into your nether regions is often quite worrying for people, but please be reassured that actually it is not nearly as bad as you think it's going to be. We will support you through that procedure, and actually it's only unpleasant for a second or two with the beginning of the injection, and the remainder of the exercise is a lot less uncomfortable than you imagine. So the injection is done and the area is numbed. And then I remove the extra tissue very simply with a pair of scissors. We then stop the bleeding with a machine that makes a little bit of a buzzing noise and sew you all up with some dissolving stitches. It's actually very straightforward and quite quick. The most important thing is to make sure that the right amount of tissue is removed. And that's, if you like, the more challenging bit. So beforehand, it's really important that you know what you're hoping to achieve and that I know what you're hoping to achieve, so we can draw some careful lines to make sure that the result you have is the result you've been looking forward to. So labiaplasty can be done under general anaesthetic, and there are sometimes situations where people prefer to go fully to sleep. But this does have its own risks. There are sometimes problems with general anaesthetic, and you may have medical problems that mean that a general anaesthetic is not safe for you. It's also more expensive because you need to employ an anaesthetist to safely put you to sleep, and you need to have a hospital bed and a hospital stay, which considerably increases the cost. That being said, the actual operation that I perform for you is exactly the same whether you are awake or asleep. It's just whether you are there with me chatting and taking part in the experience, or whether you're completely asleep and you just wake up in recovery afterwards. I don't have a problem with doing the operation under general anaesthetic if you feel that's what you would prefer, and if the anaesthetist feels it's safe for you. But by far the majority of my patients are very happy to have the operation under local anaesthetic as an outpatient in a much more private setting than in the big hospital operating theatre. So the risks of local anaesthetic labiaplasty are principally making sure that the operation is what you wish it to be. So I need to understand what I'm trying to achieve as far as the length of the labia, that we do so with a technique that is safe for you, that any bleeding is controlled in the operating theatre with the cautery machine. However, even if I do that very carefully, there is still the possibility that we can have issues with bleeding post-operatively, and you may need to apply a pressure dressing afterwards just by pressing on the area for about 20 minutes if there is bleeding afterwards. And very, very occasionally, we would need to bring somebody back to the hospital in order to take them into the operating theatre and stop a bleeding point. But this is very, very rare. Other risks are infection. And again, it's really important to keep the area clean post-operatively, and that reduces the risk of infection. In fact, the most common infection that we see with labiaplasty patients is thrush. And this is because we are asking you to wash the area a lot in order to keep away bacteria. And this does mean that the thrush organisms that carry, and you may have heard these called candida, do have a little bit of a free rein, and therefore it's quite common to have problems with itching after the surgery caused by the candida germ, the yeast. I therefore always recommend to my patients that you have some treatment for this in your cupboard, so that if you do become uncomfortable post-operatively, you can take this. The other major complication following labiaplasty is scarring, causing extra shortening later. After a labiaplasty, obviously, there are small scars. These are very difficult to see, but they do shrink a little after the surgery. So it is quite difficult to balance being as short as you wish to be without being too short. Similarly, everybody starts different from one side to the other, and therefore, try as we may, it's unusual to be exactly symmetrical after the surgery. And a degree of asymmetry or not quite symmetrical is something that is part of this surgery. It's not exactly a complication, it's really quite normal. So after the operation, you go home. You're numb to start off with because the local anaesthetic will continue to be there for a couple of hours after the surgery. Then the pain does start to come, and so we will give you a strong painkiller to go home with after the surgery. After that, there's normally a reasonable amount of swelling, and it's really important that you take to your bed and rest for the first few days after a labiaplasty. The more you're up and about, the more the swelling goes down to that area and makes you more uncomfortable. So I do recommend to my patients to rest up for the first few days after the surgery. And then as the swelling starts to subside, you can gradually start to do more. After a week, you should be back to doing most things, and it's still a little bit longer, certainly 2 to 6 weeks, depending on the patient, before you can do things that are a little bit more active, like riding a horse, riding a bike, or going back to sexual activity. We basically say, if it hurts, don't do it. Wait till your body feels ready. But for most people, it's 2 or 3 weeks before you get back to most activity.